Rattlesnake bites are something that are encountered, especially during the summertime in this climate, and if you're in Arizona or warmer climates, probably all year round. In this area, in Colorado, Wyoming, we have the prairie rattler, which we're fortunate because it's one of the least poisonous of pit vipers, and a lot of times animals will survive a bite. In any case, the way you respond to a rattlesnake bite, there's a lot of wives' tales out there, such as sucking the venom out, placing a tourniquet above the wound. All those things have since been kind of debunked because, if you think about trying to suck the venom out of a rattlesnake bite, it's kind of like giving your dog a vaccine and trying to suck the vaccine back out. The body's very efficient at processing anything injected into them or into it, and you're not going to be able to suck it out. You're probably only going to potentially cause yourself harm by maybe sucking a little bit of poison out in your mouth. So you want to try to avoid that. If you avoid those kind of things. One thing you can do in the field if your animal does get bitten, first of all, get to a vet clinic, because a lot of the care you're going to receive is supportive therapy. You can give an antihistamine, which is like Benadryl. The guidelines for that is 1 milligram per pound, because a lot of the symptoms we see from rattlesnake bites are actually allergic reactions to the venom. So if you give an antihistamine, that can help minimize the effects. I mean, it's obviously not going to take away everything, but it could help them breathe and help them be more comfortable until they get treated. Rattlesnake vaccines are something that have recently become popular, and those are actually a good thing. But a lot of people will ask me if I have a rattlesnake vaccine, do I have to go to the vet? And my answer is yes, because rattlesnake vaccines will minimize the side effects from the venom, but it doesn't completely take it away. If you get your animal in right away, especially to a big veterinary teaching hospital, they can administer antivenom, which that can neutralize the venom that's in the system. And also, especially in the case of horses, horses are often also bitten by rattlesnakes. But one of the main side effects down the road is cardiotoxicity, meaning the heart is harmed from the venom. So if you can get antivenom on board within the first couple hours, then that's a good thing because it minimizes that chance. But if you can't, if it's within, if the hospital can't get it for a day or two, then there's debate on whether it's actually effective at that point and whether the money you're going to spend to do that is actually worth it. So once again, for rattlesnake bites, the important thing is supportive therapy and getting them into a hospital right away, because a lot of your effects are going to come a day or 12 hours down the road versus immediately. For the more poisonous snakes, such as diamondbacks and copperheads, it's going to be more critical that you get them into the vets faster, and get an antivenom on board, because that's going to potentially save their lives.